Everything, right? Cannabis, move that into healthcare and autism and all the things we know.
Right. Yeah.
So as far as for the social perspective on cannabis, many Native Americans are brainwashed to think that it's a drug.
Right.
So it is
as is everyone.
Yeah. So basically, it is a federal and state and attorney kind of a term that have scared them to death. That's why they can't even recognize their ancestral plant as a medicine.
Mm-hmm.
So when you have that, you already realize how bad the situation is, how poisoned these people are, to a point where they don't even recognize what saved them for thousands of years when they had ailments and so forth.
Right.
And
right.
So if we kind of start educating, because we are just re-educating as much as we can to the elders, especially because elders have a lot to say and they have a lot of power over their community. So it's a very good idea for us to speak with the elders and for them to really understand, no, this was our ancestral plant, and they can go back to their community and say, if we use this, especially on a medicinal standpoint, it can really help both on the tribal level and also at a metropolitan level, for example. Right? We can utilize hemp and cannabis for home health patients, for hospice patients,
right?
And in children's hospitals, for example, to alleviate pain and so forth. So we understand FDA is in bed with the pharma, right? So the pharmaceutical organizations, they need patients. They don't need cured people. So if I'm a scientist with a bow tie that comes to a pharma and says, listen, I found a cure for cancer, let's say, what's going to happen to me on my way home? Something's going to happen to me, right?
So if you don't get run off the road.
We have nothing. It has nothing. The cannabis rejection has nothing to do with having no evidence that it's actually medicinal, right? It has to do with creating this industry where people are continuing to be sick, and so that's the problem. The misinformation, the disinformation, especially around cannabis and hemp.
Right, that's very important, and again, I get heated because it's very emotional and it's close to home, as we know all the disparities, even down to. Let's speak for myself directly to Native community. Cannabis has been a Schedule I drug, right? But we have watched in the recent years more opiates be distributed than ever on the face of the planet. And yet in this time, there was young people, old people alike that were being arrested, that were being treated like enemies of the state because they were holding a gram of an herb.
Yeah, and that's something that is really hard to reconcile from a conscience level.
Right.
When you're talking about this military-industrial complex, basically creating violence out of something that creates peace, and then perpetuating a law that makes the cycle repeat itself over and over and over again. I interviewed Steve D'Angelo recently. He's just started a new organization called the Last Prisoner Project. Yes, you know about it. And it's really interesting to kind of follow how tough it is, and even in states where they've passed these laws, to get people out of prison. And he said something recently, not on my show, but recently somewhere else. He said, it must be horrible to be inside a cell looking through bars and realizing that there are people making millions of dollars doing exactly what I'm in jail for. And that was a really powerful statement. And when you think about it, and I think he actually was responding to the state of Washington, their legislature passing or trying to pass a law that limits the amount of THC in extracts. Now imagine if you're a patient and you need to have a compound of 100% THC. Let's say you need that potency to add to some other profiles in order to treat your specific type of cancer, which they happen to have science for. What are you supposed to do? It really defies logic.
Yes.
But
well, for now, we need to do that on tribal lands. So this is the idea. Why even wait for federal or state decisions on the use of cannabis and hemp for medicinal purposes, where we can create actual medical cities and tourism spots on sovereign lands? So why not bring them here and we can create the city right here. FDA and USD have no jurisdiction over sovereign lands.
Mm-hmm.
Well, what's interesting to me is we're all doing business and there's an economy, right? And you and I, of course, with our show, if we're going to ask for a sponsor or something, we have to provide quite a bit of information and proof as to what we're doing, who we're reaching, right? Mm-hmm. And it's beyond me as to how certain industries with no proof of helping the community can exist. You have healthcare institutions that have existed for 100 years that literally show zero, not just zero progress, but let's speak directly to it. And again, I don't wear a bow tie, so you can meet me on the way home. I'm ready to talk to you.
Right.
Okay? And I'll speak to this, is that if IHS has been in operation for 100 years, and they're one of the biggest culprits of spreading the opiate epidemic, mm-hmm. okay, and that's federal funds that is paying for that. Mm-hmm. And then they're also culprits of a lot of really bad things in regard to Native American health care, and it's proven, it's documented.
Oh, yeah.
Okay, so an organization like that, why are they allowed to continue to exist, and why are we as Americans, we just watched the Super Bowl, and I'm down with it. I understand entertainment, right? But we were all rooting for our team this week, and we wanted that team to win. At what point do we realize that the prison industry is a team with a jersey on, and the pharma industry is another team with a jersey on, and the FDA is a NASCAR with stickers all over it? Mm-hmm. It is not an industry. It is not law. It is not written into place. They just have existed so long and have so many strategic relationships and capital and funding that we think it's law.
Mm. I'm glad he brought up IHS. Indian Health Service was established officially in 1955 and has been getting at least an average of $5 billion a year. And they actually are the reason why there is opioid abuse. Even though it's guised as healthcare service, it's really not. It's basically allocating the federal funding into administrators' coffers. So they will build hospitals that doesn't work. I mean, you have seen those hospitals. Mm-hmm. On the Navajo Nation, there are 14 of them. And all those patients are being shipped out to the city because they can't do anything. So these hospitals are being managed by administrators and clerks. Not really competent administrators either. I mean, you have so many administrative people within IHS that really don't need to be there. One person can do the job of 50. Mm. So if you can just eliminate, a multi-million-dollar salary right there and actually pay for the physicians who are down there in the trenches for them to help the patients, that would do better good. So basically, IHS is an obsolete organization.
Right.
It should be privatized and dismantled. Number one, because we can do on a private level much more good than just seeing these hospitals trying to be managed by people that are incompetent, basically. And many former IHS directors agree. Mm-hmm. We see that. One example I can tell you is that a Native American family was shipped out from a hospital on the reservation level to a hospital here in Phoenix. Okay? So if you're a hospital on the reservation, why would you ship out this person? And if it was a hospital that actually had the capability and the services in the first place, they wouldn't need to ship out grandma and grandpa. So we really need to go back to these hospitals and the healthcare system that really doesn't exist. It's just smoke and mirrors, I'm telling you.
Mm-hmm. Well, let's speak to the opportunity, like you're saying.
Yeah, so the opportunity is this. Why even wait to help a Native? Why wait to help an underserved community member when private providers and organizations can come together and just do it without asking for permission? We can build a private hospital on tribal lands.
Right.
We can build clinics for, let's say, post-rape Native American women. Mm. Okay? That's a very interesting topic, and nobody's talking about it because of chances are these women that have been raped, they also think of suicide.
Right.
Right? So we do have so many areas for us to concentrate on, and we do have so many private investors and physician groups that can come together.
It's almost like we all are in this understanding. We all, and to use a direct term, we're kind of enlightened to what the reality is, right? Mm-hmm. But what I keep seeing is a disparity of because there's key decision makers in every position as we move around, right? And when are those key decision makers going to decide, at one point, okay, we built 29 prisons in this region and we closed 26 schools. And we can talk politics if we want. We can argue budget. We can do all these things. And that's where we get lost, is that on the surface, we are the United States of America. We are free. We are free, but we house the most criminals and literally on the face of the planet. We're setting precedents, and we're all aware of this. And at what point, if you have budget, if you're working and you're operating a business, and I'm not speaking bad about entrepreneurs, I'm an entrepreneur. I work hard every day. I get up and I put every bit of passion and love and everything into it. So it's interesting to me that if you're an American citizen, you're a relative to the tribe next to you in a way, in a big way. Mm-hmm. And what I see is this disconnect. There's no dialogue. There's no direct interaction where we're completely understanding. We meet each other, and most times we go ahead with the stereotypes or we go ahead with the fears, and we don't realize that the opportunity right now in our country is very easy. We can argue about the surface stuff and who's more popular if we want. Mm-hmm. But if you're an individual that has capital, that is an entrepreneur, and you want to create something, you have to sacrifice to do this. Mm-hmm. 99.9% of the human population was hardworking, making their way so that we can get in a nice car today. So where do we connect that now? Of cannabis industry now is it's the biggest growing industry. They have a lot
fastest growing right
fastest,
now,
yeah. And there's a lot of capital. And I know there's groups doing good things. But I'm speaking on behalf of tribal nations. I'm speaking on behalf of North America, Turtle Island, this place that when are we going to all stop ignoring that we're all relatives?
Mm-hmm. Yeah. There is sort of an awakening going on right now, and I think that we can see it in our politics. We can see it in this energy that's being driven toward getting rid of some of these institutions that are really just creating horrible things. The prison industrial complex. And I can see your point, Vaughn, about the privatization of hospitals and giving people an opportunity to really run them more efficiently and all of that. But there is one privatization segment that I think needs to go away entirely, and that is the prison system. Yeah. Because it is perpetuating these ridiculous laws, and they're making lots of money incarcerating people, and for what? And it's creating more disparity and more poverty and people unable to vote, people unable to get a place to live or get a job because they have a felony record. So, it's a problem.
And on a positive standpoint, cannabis and hemp being popular and all, I think that it has the answer to many of the societal and economic development issues of all the underserved communities, not just Native Americans. Mm-hmm. On a healthcare standpoint, most of the underserved communities get less care than the rest of the population. We can see that.
Right.
But at the same time, if we can just harness the industrial hemp and medicinal cannabis, we can really see huge strides being made, because once cannabis is legalized federally, it's going to be as cheap as grass. Right, so anybody can grow, but what will remain is the expertise of it making a quality medicinal cannabis, and also the people who know how to make industrial hemp into all these different more than 50,000 products. Right.
Right. So this was going to be my next segue, and you did it for me. There's been a tradition throughout history of the indigenous cultures protecting the land, and sustainability has always been a big focus. And this is what has enabled people to live for thousands of years